Good morning.
Morning, Wendell. Okay, let's see. Okay, girls, just excuse me for 1 minute, okay? Okay, girls, sorry. Good, good. And any questions before I continue? Nope. Okay, girls. So today is going to be a pretty short day, okay? So you most likely will get it's okay, what we can call it early dismissal. Okay, let's see. So okay, just one last. Now, is anybody in doubt about hepatitis? Okay, ultimately, it's okay. It will lead to inflammation of the liver, which can become chronic. That chronic inflammation of the liver is what you actually will call cirrhosis. And in some instances, it can develop into liver cancer, or we can call it hepatoma or hepatocellular carcinoma. Okay. Another virus is the HPV. Have anybody heard of the HPV? Okay, human papilloma virus. Clear? Okay. And that's mainly considered to be we can say one of the culprits of what we call cervical cancer. Okay. Which is the cervix of the uterus. Okay. But can also lead to anal cancers and rectal cancers, and cancer of the mouth and the tongue. And now, how I get from the genitalia to the anus and from the is and to the mouth, I will leave that up to your imagination. Okay. But that's pretty much as what has been linked to the human papilloma virus. Clear? And before, mainly because they say, well, it was mainly just for cervical cancer, cause for cervical cancer. It only used to be, you can say, females who will be given this vaccine for HPV. And now they even give it to, you can say, the male partners. Or that's mainly because it can lead to cancer of the penis, rectal cancer, anal cancer, and cancer of the mouth and the associated structures. Okay, so although yes, okay, it is considered to be as okay one virus, but there are okay as different strains that okay as may affect men versus women. Okay, now for what the hell you call it? It's okay for cervical cancer. It's okay, cervical cancer. That's mainly as okay where it's going to be screened with help of Pap smears. Okay, so if anybody have ever heard of what they call a Pap smear, that's mainly as okay just a screening test for cervical cancer, and that specimen that they collect from a Pap smear go to cytology. Okay, so it's mainly as okay just a sample of cells just okay collected from the as a scraping off the cervix, which has been sent to cytology, mainly to look for if there is any suspicious looking cells in the specimen. Okay, and all depending upon us, okay, they find that they may say, well, okay, come back in 5 years for a new, that's okay, Pap smear, or come back in, okay, as a year, or in some instances, okay, even 6 months. So, okay. Any questions about this fellow here? Okay, go. Any infection you girls want to talk about? So we did MRSA, we did Enterococcus, we did, okay, yes, what was it? C. diff. We talked about hepatitis B, C. We talked about HIV, AIDS. We talked about this fellow here, HPV. We talked about tuberculosis. Any infectious disease any of you want to talk about? Flu, influenza. Strep throat.
Can you talk about hand, foot, and mouth?
Hand, foot, and mouth, my dear, that's an animal disease. I'm not a veterinarian.
They have some of the kids at my daycare are getting it.
Okay.
Yeah.
Because
My son got it too. It was like basically they said it's a hand, foot, and mouth. It's like bumps on their skin and in their palms and their mouth.
Mhm.
And at the bottom, they heel like their sole of their foot.
Okay, because I don't know much about hand and modern mouth disease. Rather, okay, it is a disease that affects the cattle. Now, how it gets from the cattle to the humans can only be okay by consumption of okay affected animals. Okay, so I remember okay when I was that's many years ago. I was in 6th grade. It actually okay it was an outbreak of and foot and mouth disease in Denmark amongst the cattle, and most of the farmers, if they found one animal affected, it's okay, the whole flock would mainly okay just be demolished. But okay, that goes and okay, it affects humans. That's weird. Let me see. Okay. Now goes, yes, okay, now what it says, sorry, I just briefly looked it up. Okay, now why do they call it hand, foot, and mouth disease? Because of pretty much blisters on the hand, feet, and mouth. Tongue. Clear? Okay. And you can mainly say, okay, anything that, okay, yes, is linked to, yes, okay, areas where these blisters develop, where, yes, okay, play a role in the spread. So you can say, okay, can spread via, yes, okay, handshakes and hugs. How does it get to the mouth? Because it can also spread via saliva from, okay, yes, kiss, or yes, okay, if you share a drink or something like that. Or you can say, it's okay, even sharing, yes, okay, utensils, like sharing a spoon and so on. So, yeah. Now, because most viral infections, there's no, yes, okay, actual treatment. Okay, okay. The seasonal flu as well, yes, okay, comes, it may, yes, okay, just have to live its course, and okay, yes, you get over it. Okay, so similarly for this one here, it's okay, there is no real treatment rather than, I mean, yes, okay, what we just call symptomatic treatment. That you may, yes, okay, just treat the symptoms. Yeah, okay. What's the main symptom? Yes, okay, rash. Okay, yes, those lesions, yes, okay, they will mainly, yes, okay, be there as long as the, you can say it's okay, infection or so on, so is still active. Okay, and then there's fever. For fever, yes, okay, just regular, yes, okay, over the counter medication. But that's mainly, yes, okay, how it's spread either, yes, okay, via direct touch. So you can say contact and saliva. Okay, and okay, as droplets. So virus, yes, okay, a regular, yes, okay, a regular virus. Anything else goes. Anything else? So don't share the straw or cup. Okay. Oh, yes, okay, container utensil that they used to eat with. Next. Okay, girls. Now we can talk about, yes, okay, medical emergencies. Clear? And what is it that we may need in, okay, as in case of a medical emergency? Now, every clinic, any place where, okay, yes, you see, yes, okay, where you have patients coming. It doesn't have to be an, yes, okay, an emergency room. Every clinic or every facility, yes, okay, mainly, yes, okay, will be required to have what you call a crash cart. Okay. Now, what do you mean by a crash cart? Any wild guess?
A heart defibrillator?
Okay. That's going to be one of the things that will be in a crash cart. Okay, defibrillator will be there. Okay, good. What else? What could be other kind of emergencies?
You have like salines and all of those stuff. And
Okay, okay. In case, okay, a slip and falls, open wounds. Okay. Things that you may need to, yes, okay, stop bleedings. Clear? Okay. Yes, okay, you may have, okay, different drugs, yes, okay, to treat different, yes, okay, possible acute allergic reactions such as, okay, as anaphylactic shock. Okay. If you, yes, okay, look at, okay, as the advertisements of different, yes, okay, medications and so on. So what is it they say at the end? If you, yes, okay, have difficulty breathing, swelling of the tongue and things like that, contact your healthcare provider immediately. Why? Because those symptoms may, yes, okay, indicate, yes, okay, and anaphylactic shock, which is going to be just a severe, yes, okay, allergic reaction. Yes, so you probably, yes, okay, will need immediate help. Clear? So, yes, okay, different drugs that, okay, yes, maybe, yes, okay, used, yes, okay, treat, yes, okay, allergic shock. Most likely, yes, okay, what they will give the patient is, yes, okay, steroids. But since it has to, yes, okay, act rapidly, okay, that's why it's going to be, yes, okay, injectable. Okay, so you can say, it's okay, you will have, yes, okay, IV lines, you will have, okay, saline bags, etc., and some things like that. Okay, so yes, okay, pretty much, okay, anything that you may need in a emergency situation will be, as okay, found on a crash cart. Clear? Okay. In most places, yes, okay, there will be, yes, okay, a spot allocated to that crash cart. They will say, okay, this is where the crash cart will be. If somebody needs it, this is where you will find it. So what will be the good thing to do once you're done using it?
Replace it and put it back?
Put it back where it was, right? Okay, okay, okay. It may be, yes, okay, all dependent upon, yes, okay, you can say, okay, the type of practice. But as okay, routinely, as okay, somebody may be given the duty or job that, okay, the first thing in the morning, go and check that the crash cart is, you can say, it's okay, fully loaded with what is going to be as okay required. Okay. Okay. So the person doesn't have to, yes, okay, run back and forth about a floor two. Yes, okay. Fetch, okay, as things which, yes, okay, may be needed, which, yes, okay, that the crash car ran out of. So yes, okay, most likely, yes, okay, should be very low. And so go for you girls. Okay, probably, yes, okay, the first thing that you should be do, if any of you, yes, okay, will be the person who opens up at the practice. Okay, where you do your ultrasounds. Okay, now your chances that you're going to be using is really nothing much than, okay, as gel is one of the things that's going to, yes, okay, be frequently used. Likewise, disinfections. Clear? And you can say, it's okay, wipes to wipe off the transducer when she disinfected. Okay, so one of the early morning tasks maybe is okay, make sure that every room has the required amount of, you can say it's okay, bottles of gel. Yeah. Many places nowadays is okay, maybe because okay, the gel is cold. Okay, they have these what they call is okay, gel warmers. Maybe it's okay, just containers in which they place the bottles with the gel, and that means it's okay, just keeps it warm, not hot, because you don't want the patient to end up with a burn. Okay, but just keep it warm. Okay, it's like at a comfortable temperature. Okay, so things like that. Okay, maybe it's okay a part of your job. Just to walk by and say, okay, which room has it's okay, maybe it's okay needing gel, etc. Okay, otherwise it's okay, every room pretty much okay will have their own machine. Clear? Okay, with there's okay the required with the required transducers assigned to as okay that room, all depending upon what kind of scannings you do. Okay, girls. Okay, but crash cart, that's mainly as okay, just going to be as okay. Very as okay, will keep as okay items or equipment that are going to be used in any possible emergency situation. Clear? Okay. Slips and falls. Okay. Okay. So you can maybe say, okay, you can say the first aid kit. Okay, pretty much okay, what you find in a regular first aid kit. Yes, okay, will be as okay, has to be as okay, stored in a crash cart. Okay, mainly because okay, it is a clinical setting. Okay, you may have patients as okay who, God forbid, or people as okay who, God forbid, as okay, go into as okay a cardiac arrest or so on, so on, whatsoever. Yes, okay, things like that. Okay, okay, so things to manage those kind of situations as okay should be as okay available and a crash cart. Now I remember an instance, and the department that we worked at actually is okay had to report that that clinician. Because okay, it was I think 4:30ish in the afternoon, and I got this call from the nurse at the clinic, and saying that okay, she was sending over a patient because that patient had an anaphylactic shock. Now, some of you will say, why did she get an anaphylactic shock in the first place? Okay, and that was an allergy clinic, and where they okay, mainly as okay, were trying to as okay treat this or as okay these patients, but her case was that she was sensitive to as okay dog dandruff, and she wanted to get a dog. So they say, well, okay, we can just desensitize you. So you immediately come in and okay, gets slight exposure to as okay the substance in dog dandruff that actually is okay may cause an allergic reaction, and they just slowly increase the dose. Here, she actually had okay as a reaction right in the clinic. Now instead of managing it there, they call an ambulance and okay, put on the ambulance and send it over to us. Now we didn't mind just okay taking care of it, but the thing was they hadn't done anything to just okay manage her anaphylactic reaction at that clinic. So we had to report that to the Department of Health. And they came by and actually found that okay, as first of all, the clinic didn't have okay as a crash cart, which was criminal. Because most of the patients that they would see there as okay might be at a great risk of developing a anaphylactic shock. Why? Because yes, okay, you expose them to yes, okay, what they are allergic to. And if you don't have, yes, okay, the immediate tools, or yes, okay, your chances to, yes, okay, deal with it, that could easily have cost her life. Right, okay. So, yes, okay, he got a heavy fine and, okay, has got a deadline. I say, well, okay, until and unless you don't, yes, okay, make such and such arrangements, yes, okay, your clinic is going to be considered sealed and closed. So, yes, okay. And so that was that. Okay, so that's what you call, yes, okay, negligence, right? Okay, not necessarily malpractice, because you didn't do anything ethically wrong. Rather, about that case, it is just negligence. Okay, that he pretty much, okay, yes, didn't made, yes, okay, the necessary arrangements as required by the Department of Health to be running a clinic like that. So yes, okay. So it's not just going to be good enough and say, okay, well, okay, yes, we have a crash car. Second, yes, okay, they should have a designated place so people, if they need it, would know, yes, okay, where to get it from. And once you're done, don't leave it. Put it back, because, okay, just like you need it, somebody else may end up needing it as well. Okay. And mainly, as okay, here in emergency situation, yes, okay, times matter. Clear? Okay. What could be another kind of emergency situation? We said shock, or anaphylactic shock, which is an allergic reaction that causes the patient to go into a shock. Diabetic shock. Now, girls, in A&P, we briefly talked a bit about diabetes. Let me just ask you, which phenomena do you think is most dangerous? A high blood sugar or a low blood sugar?
Low.
Huh?
They're low.
The low. That can kill you immediately, right? High blood sugar is just going to just, okay, slowly kill you. Okay. Okay. But what actually that's okay can kill a patient is immediately is a low blood sugar. Okay. So what do you do in that case of what do you do in that scenario? If a patient is in coma, because that happens in both cases, they may as okay go into a coma. You try a high blood sugar or low blood sugar. But what would you do? Scooby-Doo. Until and unless proven otherwise, you treat it as a low blood sugar. Okay. But nowadays, it's okay. It's easy to just okay get a recording of the patient's blood sugar, right? Glucometers. So that's okay. Every cash car will you have is okay a glucometer. Okay, you shouldn't. Okay, a person shouldn't be in doubt. Is this person here is okay having a low blood sugar, or is he or she having a high blood sugar? Okay. So they may yes okay keep things such as insulin or glucagon as well. Okay. But usually it's okay for as okay low blood sugar, they may as okay will give the patient either as okay glucagon or sugar, or as okay give them okay as a steroid injection. Because that steroid is just going to bring up the blood sugar as well. For low blood pressure, or for low, that's okay, they will just give, what the hell we call it? Or for sorry, high blood sugar, then it's okay, just give insulin, 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 insulin. Okay, girls. Any other emergency situation? Now, girls, we have, yes, okay, what we call, yes, okay, choking. What would it mean to choke? Or why would somebody choke?
If they're drinking or eating, and instead of it going down your esophagus, it went into your larynx. Because the epiglottis didn't flap down.
Exactly, right, okay. So it goes into the airways, or yes, okay, into the lower areas, okay. Okay, so larynx. Okay. What are things that people can choke on besides food and water?
Smoke. Like flames, like if it's like in a
Well,
fire.
okay, now you said smoke. Smoke is gas or fumes. What is it that smoke actually recalls that you can choke on them? It's a good answer, but okay, smoke is smoke. How do people choke on smoke? You are correct, but how? It's not only Dr. Brown who is supposed to answer. Anybody can just, okay, tell how you choke on smoke. Any idea? That was a good one. I never thought of that, but okay, here we go. That's why I say it's okay. When one teach, two people learn. Yes. Anybody? It doesn't hurt to come up with a wrong answer, girls. Say something. How do you choke on smoke? No idea. What happens if you walk into a room of smokers? What's going to be the first thing that you will do?
Start coughing
Exactly. Now, why would you cough?
because it's affecting something your lungs.
Well, okay, not necessarily your lungs, my dear, but yes, okay, your airways.
Your airways.
And
Yeah.
when your airways get, you can say, okay, irritated, what do they produce?
I don't know what they produce, but you know, when it gets swollen and stuff, it can cause like respiratory distress.
Okay.
Mm.
Now, my dear, before getting swollen, it most likely is okay, will produce something. And what do you call that? Mucus.
Mm.
Here. So yes, okay, you don't choke on smoke. You may choke on the mucus. Okay. You may choke on the mucus because, okay, you may have a hard time coughing that up. Did that make sense? That's how you choke on smoke. Did you get that, Dr. Brown?
Yes, I did.
Okay. What else can you smoke? Not smoke. What else can you choke on? Okay, girls, don't you have a young fellow, that's okay, young child in your house? Why do some show, okay, choice on the package say for children of age 3 and above?
They become choking hazards, yeah,
Why are they choking hazards?
because they're tiny and
Small
can,
parts, right? Okay. And what is a child usually is okay until the age of 3 does? Most thing they see goes in mouth. Clear? So yes, okay, what is now, yes, okay, another thing that you can choke on. Small Lego blocks and things like that, right? Who ever swallowed a penny? Have anybody ever swallowed a dime? But that's okay, you can also swallow those. It's okay. If you don't swallow it, yes, okay, you may choke on them, right? Now, have you guys seen, yes, okay, where they actually, yes, okay, pulled out a range of somebody's, yes, okay, mouth? Long live Home Depot. Somebody has okay, well, I don't know how in the hell. But it's okay, they actually is okay, choked on a wrench. Or screwdrivers and whatever knots. Now, why in the hell would you just okay put a screwdriver in your mouth and okay, yes, oop, all of them. But yes. Now, how real that is, I don't know. So, what do we really do? Yes, okay, if somebody chokes? Do you know the procedure of how to, yes, okay, relieve the patient from choking?
Heimlich,
Huh?
the Heimlich.
Heimlich, okay. And now you may not be allowed to call it a Heimlich maneuver anymore. Yes, I know.
Wait, why?
Because the family member of yes, okay, the person who yes, okay, developed this procedure here said they actually is okay claiming you can say it's okay a royalty for that for using their name, which is bullshit because the guy who is okay, I just want to be straightforward because the guy who actually is okay developed the procedure, the Heimlich maneuver himself, was asked. He was asked by okay some yes, okay medical associations and so on so on so whether he wanted okay some sort of because it's okay prize or royalty, and he said no, I did it just for the sake of humanity. Now he died and now his family is going as okay having as okay issues with it. So yes, okay, the new name is okay as abdominal thrust. Clear? Okay. But okay, we'll still says okay the Heimlich maneuver. Okay. And that says okay abdominal thrust. Now anybody knows how to do that? Now it's slightly different from adults versus infants. Clear? Now girls, let me see. Okay, no, that's not work. Okay, girls, now where are we? Okay.
Duck poop fast. Fiber helps you poop, right?
No.
So what do you do when someone's choking? Say you and a friend are out in a restaurant and all of a sudden they start choking. So I'm going to have my friend Hannah come over here And we're out, we're having a good time, we're eating, and all of a sudden she seems like she's choking. First you ask, are you okay? And oftentimes the international sign for choking is this, okay? They're like, I can't breathe, something's going on. If you're around other people, you want to get them to help you. You want to, if you're in a restaurant or a place of business, have someone, call out for help and have people help you out. Tell them what you're doing. Don't just attack them because that will just heighten their anxiety and their panic. So what you're going to do is you're going to stand behind them and you're going to wrap your arms all the way around, okay? And you want to try, you find their belly button with your pinky, make a fist, put the pinky on the belly button, then roll it up so your thumb is, the knuckle of your thumb is right there. And then you thrust, you pull it in and up, and I'm not going to do it as hard. In and up until they can dislodge what is in there and they can breathe again. Don't go crazy like in the movies and start slapping their back and like wrestling. Sometimes people get carried away and they want to slap your back and they just end up hurting you. If the person is pregnant or a larger person and you can't get your arms all the way around to where their belly button is, you're going to want to go higher up to where their breastbone is. So say Hannah is pregnant, congratulations. You wrap around, you find their breastbone, and then you just do the same thing, in and up until they dislodge whatever is in their throat and they can breathe again. If the person is so big, if you're a small person and you have a big strapping person with you who's choking and you just can't even do that, you can assist them into doing a self-Heimlich maneuver on a chair or a surface that will get to their diaphragm. You just lean them over and kind of talk them through it. Stay calm. The more panicky you get, the more panicky they're going to get. They're already in a state of anxiety because they can't breathe, which is normal. So if they lose consciousness and they fall to the floor, you're going to lay them down, you're going to roll them over, and then you're same thing. You're going to find the belly button, roll up, and you're going to thrust while they're on the floor until that comes out or until help arrives. Continue trying to do the thrusts and trying to get them to get that out of their throat so they can breathe again, and just stay with them until help arrives.
So, okay, so that was okay as the Heimlich maneuver, or as okay as we now call it, okay, abdominal thrust. Okay, so pretty much okay as with a fist right in between as okay, or here in the epigastrium, and an upward and upward push. And what that mainly cause a patient to go like this, and that's mainly as okay what may is okay dislodge whatever substance is you can say it's okay trapped in the areas. Okay. Now when they yes okay, although it's okay, she mentioned yes okay, don't hit them in the back. Okay, tap them or something. Most likely as okay, that is only going to yes okay help if okay as we said earlier, it's okay choking on smoke. Or it's okay there is some phlegm exactly that may yes okay because there's okay needed to get loosened up. If that's the case now, okay, don't bam like that one, okay? Just slightly taps on the back. And usually that's okay, what you will be doing is from below upwards. Okay, that's one main. The other thing is not with a flat hand, you're not slapping, you're not to slap the patient. You actually just okay, cup your hand like this. Okay, so it's pretty much okay, that cupping between yes, okay, the back of the chest or thoracic wall, and okay, as the palm of your hand. Actually, as okay, may help the patient to cough up, what you want to call it, whatever maybe it's. But that's mostly as okay, only in case that okay, as somebody may have a hard time breathing because of phlegm or mucus, etc., etc. Okay. But the main thing is as okay, just this as okay, thrust right here is okay in the epigastric region, right between as okay, the ribs and the chest bone. Yes, my dear.
So when you're doing that, do you have to like a certain pressure? Because you can't go to, is there like a certain pressure that you should push on?
Well, okay, not do it so hard that okay, as that it start hurting the patient.
Okay.
Okay. but it's okay. And as they show, yes, okay, if you're able, just okay, grab your hands on how much pressure. Okay, which means it's not really pressure. It's means okay, it's just that you can say it's okay. All of a sudden, that's okay, jerky movement that actually is okay, make the patient go like this, and that's mainly as okay, just what you want. Yes, okay, elicit. And okay, as that mainly is okay will help. Yes, okay, to dislodge any yes, okay, trapped substance. Okay. Any other question there? Okay. And now in children, or you can mainly say, okay, mostly as okay for infants. The procedure is okay of the Heimlich maneuver, or is okay, what we can call is okay, an abdominal thrust is a little bit different. Okay. Okay. And in this case, yes, okay, you mainly it's okay, well, okay, yes, let me do it this way here. And you can always, it's okay, watch the movie. You know. So yes, okay, for children or infants. Now, in this case, it's okay, you may be sitting. We can say it's okay in a chair like this. This is going to be as okay, you can say it's okay, one arm. Yeah. And you may have the child like this. And mainly as okay. Now, one thing is that okay, the head should always as okay be lower than okay as the rest of the body, because that's okay. That may as okay help a little bit of okay as dislodging that perhaps substance or object by as okay with help of gravity. Okay, but what you mean is okay with another hand will do here. Is mean as okay again as okay that same region right between as okay the ribs on the side, ribs and ribs, and okay, here is okay, the lower end of the chest bone. In this region of the epigastrium, yes, okay, will slightly push. Mainly as okay, just with 2 fingers. Usually it's okay, people use the index finger and the middle finger. But mainly as okay, just push here up to 15 times. Then flip over the patient so that now there's okay, the child actually is okay, will be lying with his back up, and okay, yes, mainly as okay again, slightly tap between the shoulder blades, and then flip it over again. Thrust, then flip over, tap, 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 like that. So that's mainly as okay how they do it in yes, okay, younger children, or you can mainly say it's okay, babies. Did that make sense? Okay, or okay, and I hope that this one here is okay, is the next video. Let's see, this one should be is okay. Yeah, okay. You guys can see the screen?
Yes.
Okay, so just look here. So it's okay, performing as okay, the Heimlich maneuver on a child or an infant.
Hi, my name is Aaron Gerbitavicius. I'm a charge nurse here at Chalk Children's Emergency Department. One of the most frightening situations that parents can go through is a choking episode with a child or infant. Today we're going to be talking about performing the Heimlich maneuver on your child or infant. We'll start with the infant. Recognizing signs and symptoms of choking in an infant look like a red face, choking, coughing, gurgling sounds. You will now see the steps of performing the Heimlich maneuver on an infant. The infant must be placed on your forearm, supporting the head with your hand. Find a place where you can sit with the infant, placing them head down and where you're able to support their weight securely. You will then deliver a series of 5 back blows, using the heel of your hand to the center of the back. 1, 2, 3, 4, 5. After this, you will then roll the child over, supporting the head, to deliver a series of 5 chest thrusts using 2 fingers to the center of the chest. 1, 2, 3, 4, 5. You will continue alternating between 5 back blows and 5 chest thrusts until the object becomes dislodged. Make sure to call 911 to render emergency services for your child. Now we will learn how to perform the Heimlich maneuver on a child. First, we will need to determine how do we know if the child is choking. You will see the child put their hands up to their throat, like this, showing that they are choking. This is the international sign for choking. If the child is sitting, have them stand up and explain to them that you are going to perform the Heimlich maneuver. You will now get a walkthrough on how to perform the Heimlich maneuver on a child. The Heimlich maneuver begins by wrapping your arms around the child. Then make a fist. Put the knuckle of your pinky finger into the victim's belly button. Then roll the fist upward until the knuckle of your thumb is touching the belly. Grabbing your fist with your opposite hand, thrust in and up. You will repeat this in and up, in and up, in and up, until they dislodge whatever is causing the choking and they can breathe again. It is important to remember to call 911 to render emergency services for your child. Thank you for watching this video. Here at Chalk Children's Emergency Department, we recommend that all parents take a child life safety course in basic life support and CPR.
Not just parents, guys. I think everybody. So I think that was something that should be given as on school level as part of as what you call health education. So that was me as the Heimlich maneuver, or as what we call abdominal thrust. Slightly different, from children to infants and adults. Yeah, in children, it's pretty much the same as in adults. Okay. What's the next medical emergency that you may come across?
Is it like an unconscious patient or something?
Okay, now that can be oh shit. A hell of reasons why a patient may be unconscious. Okay, yeah. But the next medical emergency that we may talk about is going to be what we call a cardiopulmonary arrest. Okay, now when you say cardio, what does that mean? Heart. When you say pulmonary, what does that mean? Lungs. What does the heart do? Beat. And when it beats, what does that causes? Blood to circulate. Clear? Okay, when you say pulmonary, that's breathing. Okay, now girls, please keep in mind, cardiac failure does not mean that your heart stop pumping. It just means that, okay, it fails to pump enough blood to, it's okay, fulfill the body's requirements, but it's still pumping. Clear? Okay, okay. When you say arrest, that mainly is okay, mean full stop, that it stopped. In this case, says, okay, you can mean says, okay, the patient stopped to breathe, and the patient stopped having a beating heart. Clear? Okay. Now here is okay, there is no doubt about it. It's okay, this patient here is going to, is okay, fall unconscious. Clear? Patients in a stroke may also, yes, okay, may not, most likely, yes, okay, will also fall unconscious. Clear? Patients with who suffer a stroke may, yes, okay, get unconscious as well. But at least, that's okay, if a patient had a stroke, he will still have a pulse. He will still be breathing. Right? Okay. So how do you know that this is not a stroke, but a case of cardiopulmonary arrest? You may, yes, okay, check for, yes, okay, what we call ABC. Okay. Nowadays, they made, yes, okay, I changed the sequence over a little bit. Yes, okay, BCA. Okay, okay. But if you say ABC, yes, okay, what does that stand for? Airways for A, B, breathing, C, circulation. Now, how do you check for the airways? Mainly, it's okay. Look into their mouth. Mainly, it's okay to make sure that they didn't choke on anything. That you obviously see anything that, okay, that they might have choked on. Clear? The next would be, it's okay to check their breathing. Now, how do you check the breathing? You may look for, yes, okay, chest movements. Clear? Okay. Now, how is that? You can mainly say, as okay, if this was okay as the upper end of the, or the upper side of the chest, you may, as okay, will bring your head down and actually see, as okay, it doesn't move up and down. Because, okay, the patient may still be breathing, but it's okay, have shallow breaths. If you don't see any chest movement, the patient may still be breathing. Now, how would you get to know about that? The back of your hand. Clear? Right up here by the nostrils. And you will actually, as okay, feel a slight breeze of air, as okay, coming from the patient's nose and hitting the back of your hand. So that would still mean that, okay, as the patient is breathing. But if you don't feel anything, that means there is no breathing. So I guess, okay, look for chest movements. Okay. Very much, okay, get down on the side of the patient and mean, yes, okay, just look for slide or yes, okay, movements of the chest. That will indicate that the patient breathes. If you don't, then he or she is not breathing. Okay. Or if not, you still want to make sure the back of your fingers like this up against, that's okay, by the nostrils. And you will feel the breathing through the nose. Mainly, it's okay, just a slight breeze of air, it's okay, hitting your fingers. Next comes that you need, yes, okay, check for the circulation. Now, how do we check for circulation? Which was as a result of the beating heart.
Can it be the color of the person's skin, like if they're turning blue or anything?
No, the blue thing is mainly as okay if they're not breathing. Primarily. Okay. How would you know that the heart is not pumping?
There will be no pulse.
Exactly, there will be no pulse. Now, what will be next then? How will you know that there's no pulse? How will you know that there's no pulse?
Because you don't feel one.
You don't feel one, right? Okay. Okay. So yes, okay. The next thing would be yes, okay, yes, okay. If you first need to know yes, okay, where to feel for a pulse. So what going to be yes, okay, a common area to feel for a pulse? The wrist, okay.
Your carotid.
Okay, carotid. I'm not a fan of the carotid, and I have my reason for that one.
Can it be your brachial?
It could be a brachial, it can even be a femoral, right? Yeah, okay. Now the reason that I'm not a fan of the brachial, sorry, carotid is really is okay, right next to yes, okay, the carotid artery is a nerve called the vagus nerve. And yes, okay, if that gets stimulated, that can actually yes, okay, lead to, in some instances, okay, patients going into a cardiac arrest. But if they weren't, by yes, okay, vagal stimulation, yes, it caused it to the patient to go into a cardiac arrest. Okay. So now you have mainly as okay, three of the things. You check for the airways, you check for the breathing, you check for the pulse. You didn't find breathing, you didn't find a pulse. What does that mean? The heart is not beating. Clear, or at least not beating in a way that pumping enough blood to produce a pulse, a palpable pulse, right? What is next? Now here is okay, you can mainly says, okay, if something isn't done, the patient is practically dead. Okay. Now just to make sure that okay, as he or she is not unconscious as okay as a result of a cardiac arrest or cardiopulmonary arrest, or something else.
Sir,
Yes.
sorry, go ahead.
Okay, sorry. That's right. Clear? Okay. There's something that we used to do which was okay as sternal rub. Have anybody heard of that one?
Is that like an AED?
No. Sternum. What is sternal? What does the word for sternal mean?
At the place where your sternum is at.
Okay. And what is a rub? Pretty much goes. Try to do it on yourself. And okay, rub that up against your sternum, and you'll feel yes, okay, that is not a pleasant experience. Clear? Even people who may be yes, okay, unconscious in one or another way, yes, okay, will respond to that. So okay, if they are responding to yes, okay, to a sternal rub, they are not having a cardiopulmonary arrest. Okay, they may just be as okay, slightly unconscious or mentally as okay, or as okay, impaired, or as okay, in a coma. but not dead, or not having a cardiopulmonary arrest. Did that make sense?
Could they be brain dead? No?
Well, brain dead, well, okay, that's a legal in definition. That's made as okay, if somebody is okay doesn't improve after okay as a several amount of hours being on okay as a ventilator. Okay, clear? Where they mentally don't recover, or you can say okay, wake up to a certain degree. Okay, and okay, that most less okay may become as okay a little better because it's okay. It's just a matter of okay when they turn off the ventilator, that is okay, the patient will stop breathing. I mean, that's okay, breathing with as a result of the ventilator being on. Okay. But brain dead is mainly as okay where the patient is okay doesn't recover after being on a ventilator mentally as okay for a certain amount of hours. And those amount of hours as okay may vary from place to place to place to place. In some cases, they will put you on a ventilator for 6 hours and say, okay, no recovery or no improvement. The patient probably is brain dead. But it has to yes, okay, be approved of okay as damage to the brain itself. And that was okay as a concussion, a bleeding, or so on, so on, so. Did that make sense? But people who are brain dead, they still have a pulse. Okay, they may not be able to breathe mainly because of this okay a loss of unconscious or loss of consciousness. That's why it's okay they put him on a ventilator. I say at least let us make him or her breathe and let's see if it's okay if he or she is okay recover from that's okay whatever trauma or damage that might have happened to the brain. Yeah, okay, but that's pretty much okay how you may that's okay check on that's okay whether a patient is in a cardiopulmonary arrest. What's next? What do you do? Scooby-Doo, what do we do? Cardiopulmonary arrest, what do you do? What's the next thing you do? You found somebody, he or she is not breathing. You don't see you don't feel a pulse.
Can you do CPR?
Yes. Okay. Now, most likely, yes, okay, in clinical settings, what they do is they issue yes, okay, a code blue. Okay, usually yes, okay, that is called yes, okay, 911. Or yes, okay, alarming the staff. Now, two incidents that I just want to, and I just hope you guys will experience the last one because okay, that had a happy ending. Now, guys, one of the hospitals that I was working at, sorry. And during SOK, the emergency SOK, I will be given a beeper. Okay, they will give you a phone and say, okay, as most likely SOK, you will receive SOK emergency calls on this phone here. But from time to time, SOK, they may even SOK choose to just beep you. And okay, it will show a number and okay, I mean, it's okay, just call that number back. No, I still remember it. Yes, okay, it was Wednesday. What a shitty day, right? Right? Okay, it was Wednesday. And at 12 o'clock, this beeper has, okay, went on loud. So loud that even, yes, okay, a deaf person without hearing aid would be able to hear it. And what they have told me is, okay, whenever you hear, okay, that loud sound, that means that, okay, that there is a cardiac arrest somewhere. So I look at it and it says OP, which is operations. But it's okay, in that hospital, we didn't have a surgical unit. It was mainly, it's okay, just a medical department hospital. So mainly it's okay, just, so it's okay, you don't have a surgical unit, so there's not going to be there's not going to be any operation theaters, if you want to put it that way. So I was, okay, where in the hell? Now this is a 7th floor hospital. And okay, as there was no elevators. So if you want, yes, okay, get to the 7th floor, you had to go the healthy way, right? The stairs. So I mainly, yes, okay, now at that time, yes, okay, I was at the ground floor, so I mainly went from ground floor to first floor to second floor. And each floor I asked, did you guys, yes, okay, alarm me for, okay, as a cardiac arrest? And everybody said, no, 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 no. I kept on showing, I receiving this number from this, beep from this number here. It just says OP. And okay, at the last floor, somebody told me, well, that's operations. I said, okay, where in the hell do I find operations at? He said, okay, going down to the 2nd floor, that's okay. And as you exit the staircase, that's okay, make a left, walk all the way down to the hallway. And okay, there's a room there, that's operations. So I go, yes, okay. Just think, okay, I've been running like a maniac upstairs from the ground floor to each floor, that's okay, down the hallway, asking the nurses, did you guys alarm me? So I got that back down there, okay, walk up to the operations, knock on the door, and then tell the guy, whoever was sitting there, and say, did you alarm me for a cardiac arrest? Because where is this person? Or what floor is it at? And he said, no, I didn't alarm anybody for my cardiac arrest. I said, okay, so why in the hell did this thing go off all of a sudden? So I just, okay, said, well, okay, whatever the case is, nobody wants to just, okay, tell me anything about what happened here. So I did what I could. I ran from floor to floor to floor to floor, now having a hard time catching my own breath. So usually around noontime, yes, okay, what they will have is, okay, at a midday conference. So I walked up to this midday conference and said, well, okay, somehow this thing, yes, okay, beeped at 12 o'clock by all the doctors who were, okay, on the different floors, that's okay, were sitting there having their lunch. And I say, okay, I went to each floor and asked, who alarmed me for a cardiac arrest? And nobody knew anything. Nobody had alarmed for any cold blue. I said, okay, you should have cold blue. And then one of the guys told me, oh, okay, Mike, sorry. I say, sorry, what? I forgot to tell you that every 3rd Wednesday of the month is testing day. So what was that? They were just testing whether, yes, okay, the yes, okay, cold blue system still worked. And I say, well, okay, sorry is too small of a word right now. Right now, I feel like, okay, yes, grabbing the heaviest item on the surface of the earth and bang you in the head with it. Because, okay, cardiac arrest or not, but I could have got into a cardiac arrest by as okay, just running up and down those stairs. And nobody else okay know anything. So not just banging you in the head with the heaviest item, I also want you to okay bang the staff on each floor with the heaviest thing on the earth, because nobody told me that. I say, okay, false alarm. It was just a testing. So, right? Okay. So yes. That was that one. Now, usually it's okay in hospitals. How would they know that somebody went into a cardiac pulmonary arrest?
They announce it, code blue.
Okay, but how would they know that Mr. So-and-so and bed so-and-so is okay, went into yes, okay, cardiopulmonary arrest?
They usually have like leads on them to
Ex-
check their heart.
Exactly.
Yeah.
Okay. So usually that's okay. Well, okay, not every patient, but that's okay. You can make that's okay, patients who may be at a great risk of okay as going into yes, okay, cardiopulmonary arrest. Most likely as okay will be monitored, right? Right?
Yeah, so when there's a drop in their, heart rate or whatever, it automatically send an impulse to the nurse's station or whatever, right?
No, they may be sitting there at the nursing station and okay as following these EKGs here. Most systems may not alarm it. The main thing that you see is like go tick, 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 beep, like that. And that beep, that means now yes, okay, now heartbeat is being recorded, right? So yes, okay, that was me and okay, as one of my colleagues, we were called down to go and wash because we had to yes, okay, do surgery. Yes, okay, on the way out of the, oh yes, okay, before leaving the floor, you mean yes, okay, just walking down the hallway to the elevators. And two nurses came out screaming, cold blue, cold blue, cold blue. So we made yes, okay, just made a U-turn. And they went, okay, as it's in room number 16, bed number 2. Good. And we walked up to that and we said, okay, just call, okay, as, or as, okay, the defibrillator and somebody to come from the institute department. So that's okay, we can start the whole thing. And we made us, okay, just ran up to this patient and okay, as the guy went, hello, Mr. Peterson. Just check, is he conscious or not? And Mr. Peterson, yes. And we go, okay. But your thing is beep, flat line, right? What happened here? Yes, okay, those stickers or electrodes were still attached. The wire in between has just got disconnected. So what the doctor did was, okay, he said, okay, that's got you an easy CPR, plucked it back, and okay, tick, 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 tick. And okay, guys, he haunted those two nurses with that for quite some time. And say every time, yes, okay, these two girls, yes, okay, are going to, yes, okay, announce code blue, I will still ask them, go and check, is the patient awake? Before you call it. So yes, okay. So luckily, yes, okay, not that much running in this case, yes, okay. Okay. So that's okay. If in your place, that's okay, they do routine testing for that thing, please make sure that you inform the new employers, and especially that's okay if that employer that's okay is to hold the beeper on that day. Okay. Otherwise, they may come and say, well, okay, as a punishment, yes, okay, now you have to run up and down the stairs of, okay, 7 floors, 7 times. Any questions?
So for us as cardiovascular techs, I mean, I never shadow one before or anything. Do we like get beepers and stuff like that if we work in a hospital?
No, you probably not have a beeper. But at least yes, okay, well, you will have to know yes, okay, how to initiate what you can call as okay, a cold blue.
Okay.
Right, okay. But that's something that okay, they will tell you yes, okay, on your site, because every place yes, okay, may have yes, okay, the different yes, okay, mechanisms and things like that. Okay, how they do it. Okay. But yes, okay, on top of that, yes, okay, everybody should know to do yes, okay, what we call CPR. Clear? And does anybody know what CPR stands for? CPR. You have a cardiopulmonary arrest, right? So for that, you do CPR. So that's going to be okay, a cardiopulmonary resuscitation. Now, how do you do that? Now, things have changed a little bit. Clear? Okay, things have changed a little bit. When I first learned to do CPR, it was 30 compressions and 2 mouth-to-mouth breaths. Nowadays, they say, well, okay, yes, you don't have to do the mouth-to-mouth. Clear? So nowadays, yes, okay, unless and until, yes, okay, you want to do, yes, okay, the mouth-to-mouth, or what they may call, yes, okay, one of my teachers used to call, yes, okay, the kiss of life. Yeah. It's made as okay, just going to be as okay, 100 chest compressions per minute. And how do you do chest compressions? Mainly as okay, kneeling on your knees. Clear? Arms straight out. And push. Okay, where do you push? Right here is okay, on top of the heart. Clear? Okay. Now, in most instances, okay, you may have just okay, call somebody. That somebody is okay, most likely is okay, will have just okay, gotta call 911 or it's okay, a code blue. Clear? If you're out there in public, it's 911. Clear? But then you okay, may have to okay, change. You may do compressions for 5 minutes, then he does it for another couple of minutes, then like this. Okay, so on an area is okay, 100 compressions per minute. Okay, occasionally yes, okay, checking for the pulse. Okay, or it's okay while that person is compressing. There's a second, while that person is as you are compressing, he may be checking for the pulse. Now, when he goes into yes, okay, do the compressions, you may try to just okay, check for the pulse. Yes, As, do you have a question here?
Yeah, when I took my CPR class, they gave us a thing that you have to put on the person's face. Like if you have to do the mouth to mouth part. Do they do that in the hospitals too? I know it's because of COVID, but I don't know if that's just something that they do outside of hospitals.
But what that thing mainly is mainly it's okay, just a one-side valve. So that's okay. It's not going to be as okay. They may even have that as okay, that mouthpiece like thing in okay, as in the crash cart. Okay, but right nowadays that's okay. You can make it okay. The mouth to mouth is pretty much optional. Did you get that?
Yeah, thank you.
Okay, okay. Now they may put, okay, yes, you can say, okay, that kind of, yes, okay, mouthpiece if you want to put it that way. And okay, yes, not do mouth to mouth, but actually that's okay with the help of, okay, as a ventilation balloon. Because practically here, it's okay, the patient isn't able to breathe on his own. Clear? Now, if you paid attention to it, okay, when we talked about it, okay, supplying air to the patient, I said, no free running oxygen to an unconscious patient. That's what you have here. Forget about unconscious, that's okay, he actually is okay, he or she is actually dead until and unless it's okay, he or she is being revived back. Did that make sense? So you don't give yes, okay, free running oxygen to this patient here. He or she is okay, has to yes, okay, get ventilated. And that's what you mean is okay to blow out. Just like okay, ventilation, what did that do? Blow air into the airways, and that causes it to is okay, fill up with air. Did that make sense? So if they don't do as okay, the mouth to mouth, which is actually as okay, direct mouth to mouth, or as okay, through as okay, that valve mechanic or valve that they may as okay put in the patient's mouth. Okay. And they may as okay just say, well, okay, while you do the compressions, and okay, as I would just may as okay, do the ventilation with the help of the it's okay, maybe as okay, a mask, and okay, done with the ventilation balloon, which is made as okay, a bigger balloon is okay, pretty much okay, the size of a basketball. That means okay, just gets compressed. And okay, as means as okay, pumps air into the airways and lungs. Okay. But if you are, let's say, as okay, if you are alone and you say, okay, what should I do? Scooby-Doo. Then you can say, it's okay, well, the main thing is going to be as okay, the chest compressions. Okay, so that's okay. The mouth to mouth on the ventilation, if that's what you want to call it, that's okay. It's pretty much optional. Okay, did that make sense there?
Sir, this might be off topic, but you know, I've seen it in I never seen it in real life, but when they have to puncture your neck, your throat right here, what is that called? And push.
Tracheostomy.
Okay. So
Okay, but that's may says okay, something that they may do in case of okay, yes, choking.
choking.
Okay. If it's hard to, let's say, it's okay, dislodge, then the next thing will be it's okay, a tracheostomy. Yes, my dear.
Can they do a tracheostomy if they're trying to do what is it called when they try to put a tube down your throat for you to breathe with the pump?
Mm-hmm.
If they cannot get it through, do they do a tracheostomy
Then that's the next thing, yes.
Okay.
Okay. Okay. So it's not something that should be done immediately as okay. You can say it's okay, that may as okay, just be as okay, a last resort. Clear? Okay. But if something is stuck down, deeper down in your airways, as okay, then a tracheostomy is not going to do it. Because whatever air passes in through here is okay, it's going to run into a dead end and never make its way to the lungs. Yeah. Okay.
So how would you know if you're doing a CPR on someone and they're not getting enough air, like the chest compressions, or you giving them mouth to mouth? How would you know if they're not getting it?
If the chest doesn't expand, that means the air didn't reach the lungs, right?
Okay.
Yeah.
And what if the air doesn't reach the lungs? What do you do at that point? Like you can't do nothing really, right?
No, not much.
Mhm.
Okay, but again, as I can say, yes, okay, the primary thing is to, yes, okay, chest compressions. Okay. mainly, yes, okay, just to keep, yes, okay, prime, yes, okay, to try to keep, yes, okay, the blood in some sort of circulation. Okay. Now, back in the days, you may see, yes, okay, those in, okay, yes, many hospital shows, movies, exactly, that they have those two metallic jumpers. Okay, okay, and it's made as okay, just going to be as okay, you can say it's okay, jumpstart the heart. Yeah, okay. So what is it that actually is okay runs through that? That's made is okay, what we call is okay, we practically call is okay, defibrillator. But it's okay, what it does is it shocks the heart. Okay, mainly as okay to, you can say it's okay, elicit or stimulate that's okay that conduction pathway of your heart and try to it's okay cause it to just okay start working on its own again. Okay, so it's pretty much okay as just like okay as jump starting a car. Okay, with help of okay it's actually it's okay electrical. Okay, now those two is okay actually that's okay defibrillators. That's made as okay what you only find in hospitals. Okay, now what they have done, they've been around for okay as okay quite some time now, is what they call as okay an AED. Okay, okay, there's what they call as okay an AED. And AED is okay again is okay is an abbreviation and stands for automated external defibrillator. Yeah. Okay. Now these are mainly as okay going to be as okay. You will have them in any public place. Okay. So that's okay. Shopping malls, libraries, cinema halls, schools, universities, colleges, any place that's okay. Even bars and pubs and cafes and things. Okay. Any place where okay as people may attend together, it is going to be as okay a must to have that. Okay, you can even go buy your Stop and Shop on ShopRite or Walmart or whatever. There's going to be as okay at least one AED present at the spot. Otherwise, the place is not going to be approved to be as okay public safe. Okay, now this automated AED, yes, okay, you don't really have to just okay be a scientist or like a medical professional in whatever capacity to be able to just okay operate this thing here. It pretty much tells you just okay what to do and how to do it. Okay, so that's when you see as okay that they have okay these two big stickers that they apply. Okay, the only thing that you need to know is okay is as okay to turn it on. Okay, so that's me as okay going to be a power button. Now this thing here is okay, it's automated in the sense that okay, it will run an ECG. Or you can say it's okay, a recording on the heart. Okay, because look at the last word, defibrillator. Mainly as okay, it's going to as okay reverse a fibrillation. Okay. So it's not going to be every case as okay where you don't have a pulse that is going to be as okay what we call as okay a shockable rhythm. Yeah. So what these machines actually is okay here are able to do is check the beating of the heart. And is it okay as a arrhythmia, dysrhythmia that needs to be shocked? It will tell you, shock the patient. So that means okay will be as okay another button that being as okay will just need to get pressed. And what that would do is, before shocking the patient, it will warn you. Stay away from the patient. Because what's going to happen next is going to just okay send an electrical signal to the heart, but practically yes, okay, electrocute the patient. Clear? And it's electricity. It's going to just, okay, run through. And if you are touching the patient, then what happens next? The electrical signal will run from the patient into you. And if it is strong enough a signal to just, okay, start a stopped heart, it's also going to be strong enough to just, okay, stop a beating heart. You see, Haley, that was contagious. Now we have somebody else yawning as well. Here? Okay. So yes, okay. If the patient is on the floor, don't touch the patient. If the patient is on his bed or bed, don't, yes, okay, touch the bed. Because, okay, it's going to run from the patient to the bed, from the bed, if you're touching it, to you. And the next thing is, dumb. You may be needing, yes, okay, to get shocked. Here? Who are traveling a subway in New York? I don't know about other cities, but I know that much about New York. What is the announcement that they make every time that the train is about to go?
Stay clear from the open doors or
Stay clear from the closing doors, please.
closing doors.
Oh, here, yes, okay, stay clear from the patient. Okay, so this machine, yes, okay, is pretty much okay. The only thing that you have to know how to do is how to turn it on. The rest is okay, pretty much okay, tells you where to apply what electrodes, if you want to call it. Clear? Okay. And okay, yes, shock the patient. And it's going to take care of the rest. You just have to just, okay, push the button to shock. Okay. And where do you find them? Yes, okay, mainly any public place. Schools, shopping malls. Okay, any place where it's okay that's yes, okay, meant to yes, okay, accommodate okay, yes, XYZ amount of people. Where yes, okay, be required to have an AED or an automated external defibrillator. Okay. Okay. Now goes, there's one other last thing. And that's what we call a DNR. Have anybody heard of a DNR?
Do not resuscitate.
Do not resuscitate. Clear? Okay, so some people may say as okay, or make a decision. If I fall unconscious or as okay, go into as okay, a cardiopulmonary arrest, don't touch me. Don't resuscitate me. So that's mainly as okay, what we call a DNR. So it stands for as okay, do not resuscitate. And people who have a DNR, yes, okay, should not be resuscitated. Okay. Now, some of you say, how in the hell do I know that Mr. Jackson, who fell, that's okay, collapsed in ShopRite, had a DNR? Now, okay, usually it's okay, they may be wearing a bracelet or so that says it. If they have a DNR and they have a DNR bracelet, but they left that at home, then okay, yes, legally it's okay, you cannot be held responsible for trying to, yes, okay, resuscitate them. But that's pretty much okay as just a decision that they have made. Okay. Okay, so people who have a DNR, yes, okay, do not resuscitate them. Any questions? Now, let me just see because okay. Okay, good for you. See. You guys can see this thing?
Yes.
Are you okay? Are you okay? You, call 911. You, get an AED.
This is a scene that plays out over 1,000 times every day in the United States. If you see or find an adult or teen who has collapsed, they could be in cardiac arrest, and you need to act now. Assess for any signs of movement or normal breathing. If the person has slow, deep gasps, this is not the same as breathing. Call 911 or direct someone to call. Treat. Press hard and fast on the center of the chest. Place the heel of your dominant hand directly on the center of the chest and interlock the fingers of your other hand. Keep your arms straight and lean over the victim, using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second or 120 times per minute. Allow the chest to recoil completely with each compression. If the victim is on a soft surface, like a bed or a couch, move them to the ground before beginning compressions. You may have heard in the past that you must do mouth-to-mouth ventilations. Mouth-to-mouth is not needed for adults or teens and could be harmful. Perform chest compressions only. However, mouth-to-mouth is needed for young children and infants. While performing chest compressions, direct someone close by to get an AED. The AED, or automated external defibrillator, is the only thing that will shock the victim's heart back into normal function. When the AED arrives to the victim, simply turn it on and follow the voice-guided instructions.
Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
The AED will only deliver a shock to someone who needs it, so do not be afraid to put it on anyone who is unconscious. Now that you know how to act, let's watch this again.
Are you okay? Are you okay? You, call 911. You, get an AD.
Keep your arms straight and lean over the victim, using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second, or 120 times per minute.
Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Shock advised. Press flashing shock button. Shock delivered. Start CPR.
In many instances, an ambulance or other medical professional can be 5 to 10 minutes away or more. Continue chest compressions while rotating compressors every 2 minutes until help arrives, and continue to follow the instructions of the AED or 911 dispatcher. You be the hero. Teach your friends and family to act now.
Okay, girls. Any doubts? Okay, now just keep in mind that this session here doesn't make you CPR certified, okay? Now, how many of you have a CPR certification or CPR certified? Okay, those of you who rose their hands, okay, good, good. That's say AHA on it. You've probably been given, okay, as a smaller wallet size card to keep on you, right? If it says AHA or SOK, give you SOK, that logo of AHA, American Heart Association, then you're good. Those of you who don't, well, now not now, because it's okay, you still have, okay, as approximately a year and a half before it's okay, you will be going out to clinics and so on. So, or I guess that's okay, actually be dealing with patients, right? But just make sure that, okay, as you have that handy before that time. I may, as okay, every time. Okay. Try to see if I can talk to our director, because pre-COVID, yes, okay, we used to have an annual session in the school for the students to, yes, okay, get CPR certified. And rather than, yes, okay, because if you look out there, yes, okay, if you go to Red Cross or any place, they may charge you up to, yes, okay, $150 to get certified. Okay. So we were able to, yes, okay, do that, yes, okay, for, you can get certified for $10. And okay, yes, I remember at least once there's, okay, they didn't even charge the students. Okay, that's on the school. So, okay, but yes, okay, that's going to be, yes, okay, a requirement for you girls at least, since that's okay when you go out there and, okay, yes, are directly dealing with patients, that you have to be CPR certified. Yes, my dear.
Wasn't that training like a day training too? Just one day, right?
Yeah, just one day, just a couple of hours, like, okay.
Right.
Officially it says 4 hours. But yeah, it's okay, once the person is done talking, showing us, okay, the demonstrations and so on, so it's mainly, it's okay, just up to you guys to, yes, okay, go and kill the baby and kill the doll or mannequin. right? Okay. So now I used to work as a tester for one of those SOK companies who make those mannequins. Anyway, that's okay. You can say it's okay. CPR, not CPI as okay, but okay as different SOK software programs or simulators, as they may call it. So Sophus Lairdal, that's okay. So most of it's okay. Those of you who have done phlebotomy, most of the places that's okay will have those mannequin arms. So that was mainly it's okay. Mannequins for CPR. That was the hardware, and then we had okay software. So where we mean is okay did develop SOK simulators where you could give drugs and so on, so to the patient on a computer simulator. So, okay, goals, but yes, okay, that was pretty much okay. Now, hold on, just make sure. Just make sure. And just make sure. Hold on, girls. Just make sure that your CPR or resuscitation or whatever you do doesn't end up like this. New share. Why? Why not able to open it? Oh, okay. Maybe I just go on with another laptop. Okay. That's a shame. Why? Not full screen. Okay, girls. So what was the moral of this video? What did you learn from it?
What not to do.
Okay, so what not to do? What shouldn't you be doing?
He used a magazine to give him air. And then he didn't do any chest compressions at all. But he did shock him, but I don't know if that's the right way to shock him.
While it brought him back to life. Okay. Now, probably not the right way to do it, but anyways. Nobody want to say anything? What about do not jumpstart your car from an ambulance? Okay. Okay, girls. So that was all that I could offer for today or for this module here. Okay.
And typically you don't answer this question, but should we look up like pictures in case you give us pictures on our final?
You can just look at the pictures that are in the book,
Okay.
but there's going to be no labeling, right? Okay, let's just be honest about that.
Is the exam tomorrow or Friday?
No, we take it on Friday, so you can just use tomorrow as if you want to. It's okay. Read on the points that I send you, girls, because that's pretty much okay. That's what you will be asked about.
Okay.
Yeah. Oh, it's okay. Want you? It's okay. And I don't know how much or how many of you is okay. Try to yes, okay, review the Zoom links that I'm sending. Okay, but just keep in mind that okay, yes, you can always fast forward them. You don't have to download them. You can make it okay, just play them off the link and password that I send you. Right. So pretty much okay as the things that we have talked about. And okay, well, most is okay what you'll find in my what do you call it? It's okay. Notes that I've sent to you. Yes, okay. That's what the yes, okay test is going to be from. Okay. Now go this module here is okay. There's really not much to talk about. I just made up a lot of things. Okay. And we can say it's okay. This to me is okay. Just the silence before the storm. Now you go just okay. Have a week off. Now I don't expect anybody to fail the test on Friday. It's ridiculously easy. And okay, if you choose to fail it, then okay, yes, I don't really know what else to say. Clear? So and okay, as I already okay provided you with the material to read on. And if you just paid a little bit attention to is okay, the chit chat I've been doing in between, yes, okay. You should be able to, yes, okay, pass it. And most of it is me, it's okay, just common sense. Okay. And it's a relatively small test, so yes, okay, but the rules are the same. Answer them, make sure you write your name, you sign before handing it in to me. And mainly it's okay. Just go home and okay, wait for an email that will send you, yes, okay, the result. Okay. I may have a slight change of that last part, all depending upon if okay, whether your books are in or not. Clear? Okay, your books for physics. Because okay, if they are in and okay, you pass it, then okay, yes, you can pretty much just okay go and pick them up. Okay, so let me just confirm with the school whether your books are in or whether they're going to be in, because it's okay, you have a week off in between. Okay, girls.
So Are we still coming online tomorrow?
No, not unless you guys want to. Okay, so you can mean it's okay, just do it's okay, self-paced study, or it's okay, whatever you want to call it. But it's okay, if there's anything you still it's okay, want to ask, well, okay, you got my email. Okay. But everything is pretty much okay as in the notes that I've sent you. Or you will hear it's okay being mentioned or talked about, it's okay in any of the Zoom sessions. Okay, goes now. If you go watch, yes, okay, take a break, come back to study, yes, okay. I'll be here till, let's say, approximately 12:30ish. If somebody has any questions, okay? Okay, have fun to learn.